One condition we treat in our office is vertigo. So a lot of times with vertigo, the key is figuring out where it's coming from. So is it coming from your inner ear, or is it more cervicogenic in nature? And what do I mean by cervicogenic, meaning it's coming from the neck. So when I'm examining a patient with vertigo, we're gonna kind of put them through some range of motion to see if we can cause that vertigo going through that range of motion. So what we're gonna do, Renee, I'm gonna have you bring your chin down to your chest. What we're gonna do, we're gonna flex her head forward. We're gonna see if she feels any just tension, which she probably feels some tightness. Then look up towards the ceiling. Good, and then look straight ahead. Now what I want you to turn your head to the left side for me. Good, and then let's have you turn your head to the right. Good, and you can relax there. Say that patient had vertigo when we were turning her head to the right. What we're gonna do now is we're gonna check out the muscles in her neck, we're gonna check out the joints, because chances are that's what's triggering a lot of her vertigo. If you ever had vertigo, or if you've heard about this, basically it's like a spinning sensation, like an uneasy, like you're gonna fall kind of sensation. And often it's associated from laying down to a seated position or rolling over. If your neck is really tight, a lot of times that can trigger the vertigo. So it's a very common condition we treat in our office. Once we've determined that the vertigo is coming from the neck, then we're gonna talk about the treatment. So what we wanna do is we wanna loosen up those muscles in her neck that are really tight, and then we wanna help to restore the joint motion to help relieve a lot of that pressure and tension. One soft tissue treatment that works really well when treating vertigo is dry needling. So with dry needling, what we're gonna be doing is we're gonna be placing a couple little acupuncture needles into some of these knots or trigger points in her neck that could be causing the vertigo. So when these muscles get tight and you go through the range of motion, that's what often will pull on the neck and then cause the vertigo. So what I'm gonna do, I'm gonna demonstrate what dry needling looks like in this upper cervical area. So we're gonna place a couple little acupuncture needles in these trigger points. So the first one is here. And a lot of times when we're treating these knots, these trigger points, the patient will feel when we hit that spot, they'll be like, ooh, that's the tender spot that's been causing me a lot of neck pain and or the vertigo. Now, what causes a lot of this neck pain is our posture, our ergonomics will put a lot of pressure on these muscles throughout the day, and that's what can lead to that chronic muscle tension in the neck, and then you can get vertigo. Once we've treated all the muscles in her neck and upper back to relieve a lot of that muscle tension, so what we're gonna do then is we're gonna do a chiropractic adjustment to the joints in her neck to relieve that pressure on the joints, which will also help with the vertigo. So now that we've cleared out any of the muscle tension in her neck, now what we're gonna do is we're gonna do a chiropractic adjustment to the joints in the neck. This can often help relieve a lot of the vertigo symptoms as well and help to restore that motion, that range of motion back. So what we're gonna do is we're gonna do an adjustment. You may hear a little pop or a click, and that's normal and safe. It's just a gas bubble releasing in the joint fluid. So if you hear that, that's what's gonna be occurring. So we're just gonna palpate her neck. We're feeling the area where the problem spot is. There it is. Good. So what that did, that would help restore that joint motion and open up that joints, and it takes a lot of pressure off of the neck. Once we adjusted all the joints that need to be released, then what we're gonna do is we're gonna go through some range of motion again with the neck and see how our range of motion improved and hopefully relieved her vertigo symptoms. So if you're suffering from vertigo, give my office a call at 703-912-7822 or schedule online at novachirowellness.com.